Hello guys, today we discuss about humerus bone. It has three parts, upper in, lower in and shaft. अपर इन में जो पार्ट आते हैं वो हेड, नेक, ट्यूबरकल एंड बाइसिपिटल ग्रुप. और लोअर इन में जो पार्ट्स आते हैं वो एपिकॉन्डाइल, सुप्राकॉन्डाइलर रीज, फोशा, ट्रोक्लिया एंड कैपिटुलम. This is head of humerus. Head of humerus articulates with the glenoid cavity of scapula and form shoulder joint. This is neck of humerus, anatomical neck of humerus, morphological and surgical neck of humerus. Greater tubercle and lesser tubercle. Greater tubercle elevation that form the lateral part of the upper end. Its posterior aspect is marked by three impressions: upper, middle and lower. And the second tubercle is lesser tubercle, elevation on the anterior aspect of the upper end. Muscle attachment on greater tubercle, supraspinatus, infraspinatus and teres minor. These three muscles are inserted into the greater tubercle and the subscapularis muscles are inserted into the lesser tubercle. Seats: supraspinatus, infraspinatus, teres minor and subscapularis. These are rotator cuff muscles. This is crest of greater tubercle and lesser tubercle. Then bicipital groove. Bicipital groove is longitudinal concavity between the lesser tubercle and greater tubercle. In between, long head of biceps brachii pass through it, and bicipital groove is also called intertubercular sulcus. Muscle insertion on bicipital groove. Latissimus dorsi. It is inserted into the floor of the intertubercular sulcus. And pectoralis major. Pectoralis major inserted into the lateral lip of the intertubercular sulcus. And the teres major inserted into the medial lip of the intertubercular sulcus. This is deltoid tuberosity. There will be insertion of deltoid muscles. Radial groove, also called a spiral groove, and it is continue as lateral border of shaft. This is all about upper part of humerus. Now we discuss about lower part of humerus. Two epicondyle of humerus: lateral epicondyle, medial epicondyle. Medial epicondyle present on the medial side of lower end and the lateral epicondyle present on the lateral side of lower end. In lower end, two supracondylar ridge, lateral supracondylar ridge and medial supracondylar ridge. Lateral supracondylar ridge present above the lateral epicondyle and the medial supracondylar ridge present above the medial epicondyle. Lower end has three fossa: olecranon fossa, radial fossa and coronoid fossa. Olecranon fossa lies just above the posterior aspect of the trochlea, and the coronoid fossa present just above the anterior aspect of trochlea. And last, radial fossa. Radial fossa just above anterior aspect of the capitulum. This is capitulum and trochlea. Capitulum is rounded projection shape which articulate with the head of humerus, and the trochlea is pulley shaped. It articulate with the trochlear notch of ulna. So this is all about lower end of humerus. Now we discuss shaft. Shaft is round in the upper half and the triangular in the lower half. It has three border and three surfaces. Firstly we discuss border: medial border, lateral border and anterior border. First, anterior border. Anterior border, superiorly it forms the lateral lip of intertubercular sulcus, and its middle part form anterior margin of the deltoid tuberosity, and the lower half of the anterior border is smooth and rounded, or inferiorly it is unprominent. Second, medial border. Medial border superiorly फॉर्म करता है मीडियल लिप ऑफ इंटरट्यूबरकुलर सल्कस, एंड द मिडिल पार्ट जो है वो प्रेजेंट अ रफ स्ट्रिप, and it is continuous below with the medial supracondylar ridge. Inferiorly it forms the medial supracondylar ridge. And the third is lateral border. Lateral border, superiorly it form unprominent, inferiorly it forms the lateral supracondyle ridge and it is prominent only at the lower end. Now we discuss surface. Three surface: anterolateral surface, anteromedial surface and posterior surface. Anterolateral surface present between the anterior border and lateral border, and the anteromedial surface present between the anterior and medial border, and the last posterior surface. Posterior surface lies between the medial and lateral border. So guys, this is all about humerus bone. Please like, share and subscribe my channel PTmedicoz. Thank you.